Let's head to Queen's Park now, where the Ford government continues to signal change within its healthcare system amid questions regarding the privatization of the sector. In the meantime, Ontario's health minister gave a sneak peek of what's to come. Jason Gaidola reports.
We can no longer stand by and support a status quo that cannot respond to the current challenges the sector is facing.
During a conference with the Association of Municipalities Ontario, Ontario Health Minister Sylvia Jones gave a preview of how it plans to stabilize a healthcare system under pressure and remain open in Ontario.
These challenges require bold and innovative solutions to better integrate patient care for all Ontarians, which is why we will continue to address short-term stressors.
Jones says it's expanding its 911 model of care program, which includes allowing paramedics to treat patients in need of palliative or mental health care and/or transport them to a facility that's not an emergency room. Government sources tell CHCH News tomorrow the health minister plans to unveil more details on paramedics' expanded role and moving patients to proper care spaces. Currently, they say 24% of occupied beds are patients who would be better served in other facilities. Meanwhile, at Queen's Park,
and every other CEO that are feeding us information to help the system, every one of them said the same thing. You can't stay with the status quo.
Premier Doug Ford is still under fire for the potential privatization of healthcare services.
He thinks that public health care, publicly delivered health care, doesn't work. That's pretty clear. He was attacking the quote-unquote status quo. What's happened is we've had public health care that's been starved for funds.
The Premier doubled down that Ontarians will be covered.
Mr. Speaker, no one in this province, as long as our government is here, no one will have to pay with their credit card. They'll be paying with their OHIP card.
While the Ford government continues to promise more cash for PSWs, training nurses, and 2 new medical schools, opposition leaders believe for-profit operations will fracture our workforce.
They should be strengthening our public health care system, not running the risk of having a parallel system that draws staff away from our publicly funded healthcare system. And that's happening right now with agency nurses. You can see that.
According to CHCH sources, the health minister's announcement will be tomorrow morning in Toronto. Jason Gaidola, CHCH News.